Here's another classic disease. Out here on the feathered edge, the most noticeable thing is platelet clumping, which may or may not have caused this patient to have a spurious platelet count result. As we go into the zone of morphology, we first note that there is a prominent granulocyte population with a definitive left shift, and as we move around, we see that there are numerous basophils. Basophilia is commonly associated with chronic myeloproliferative disorders. In particular, chronic myeloid leukemia should be first on the diagnostic list. Basophilia may also be seen in reactive conditions such as allergic disorders, hypersensitivity reaction, influenza, smallpox, chickenpox, rheumatoid arthritis, ulcerative colitis, chronic renal disease, and following radiation. Elevated white cell count with a basophilia is a common finding in the chronic phase of CML. And in this setting of basophilia with a left-shifted neutrophil population, we are highly suspicious that this patient might have a chronic myeloproliferative neoplasm. The finding of a Philadelphia chromosome with a classic translocation 922 with BCR-ABL fusion gene or RNA transcripts confirms the diagnosis of chronic myeloid leukemia, often abbreviated CML. CML has three phases: a chronic phase, an accelerated phase, and a blast crisis phase. Chronic phase is defined as a blast count less than 2% of the white cells. To make the diagnosis of accelerated phase CML, one of the following findings must be present in the blood or in the bone marrow: blasts accounting for 10 to 19% of white cells, basophils representing greater than 20% of the white cells in the peripheral blood, persistent thrombocytopenia of less than 100, persistent thrombocytosis of greater than 1,000, increasing spleen size and increasing white cell count unresponsive to appropriate therapy, or cytogenetic evidence of clonal evolution, including development of an additional genetic abnormality such as an extra Philadelphia chromosome, trisomy 8, trisomy 19, isochromosome 17q, and translocation 321. On bone marrow biopsy, the finding of clusters or sheets of megakaryocytes with significant fibrosis and or marked granulocytic dysplasia may be considered suggestive of an accelerated phase CML. And lastly, blast crisis phase of CML resembles an acute leukemia and is characterized by one or more of the following findings in the blood or the bone marrow: blasts accounting for greater than 20% of the white cells, large aggregates or clusters of blasts seen in the bone marrow biopsy, and extramedullary proliferation of blasts. The lineage of the blasts is typically myeloid, and about 30% of cases will have lymphoid blasts, including both B and T cell lineage. Additional testing is required in determining the lineage of the blast population.